Good day, and thank you very much for a few minutes of your time for me to introduce you to a manual that Dana, Jacoby, and I have constructed. And let me say from the get-go that the majority of the work effort, the organization, the writing, has been through Dana Jacoby's hard work. I have asked what-if questions, and can you explain that, and can you clarify this issue? But again, the majority of the work was due to her hard and very attentive details. My name is Paul Schellhammer. I came to Norfolk, Virginia Beach to practice urology in 1974, and currently, through the good graces of Urology of Virginia, still practice very part-time office urology, dealing with patients with advanced prostate cancer. And so I am in the University of Urology, really on the outer rim of Pluto, looking in on a very complex and very intricate world of urologic practice. And I'm struck with the contrast between how I entered practice in 1974 and how residents address the situation today. Very complicated in my mind. When I address and attend academic conferences, there's a wealth of new procedures, new medical, pharmaceutical interventions. Just in the realm of prostate cancer, which was stagnant with androgen deprivation therapy for 70 plus years, we now have a number of agents to combine and sequence, and the same thing is happening with bladder cancer, renal cancer. And then we have the subdisciplines of pediatric urology, infertility, stone disease, men's health. So a vast array of information to assimilate. I attend the group conferences dealing with the business of urology, guidelines, monitoring of pathways, compensation, reimbursement. Again, a dizzying array of problems and issues to deal with. And it strikes me that a manual or primer that might be informative to urology residents would be very helpful. I attended a EuroGPO conference in Washington, D.C. about 6 months ago, and perhaps many of you were there as well, and heard Dana Jacoby give a very clear and informative lecture as to the best way to organize a practice, establish a culture, establish a mission. She had been to our offices previously, so I was aware of her skills in this department. But again, the idea of constructing a manual for residents came to mind, and I presented that idea to her. But her calendar was full, and she declined, and that certainly was understandable. But later I came back with a question to her, namely, how much more valuable might it be for residents before they commit to a job or a practice, know the questions to ask, have a better idea of the playing field that they wish to enter, and wouldn't that be more valuable than subsequently after a commitment trying to reinvent, retool, reaccommodate thoughts and processes later rather than up front? And similarly, wouldn't a practice be to the advantage of knowing what questions residents are interested in to better explain their mission, their culture, their modus operandi, so a better fit would occur when a practice negotiation and commitment was made. So based on these concepts, this guideline, this manual was constructed, and we hope then when you review it, you will agree with us that it does fulfill a mission of allowing the resident to have a better informed decision-making sequence. We use that informed decision-making process for patient care every day, so we now apply it to the situation whereby a practice and a resident meet in an effort to find the best fit going forward for a successful and satisfying career in urology. So again, thank you for your time today. I hope you enjoy Las Vegas. Beware of the tables of chance, however, and enjoy the rest of your meeting. Thank you again.